Vacation week is almost over for thousands of public school students here in Massachusetts. So here right now to answer your questions about sending them back to class is Dr. Rick Malley, an infectious disease specialist at Boston Children's Hospital. Doctor, it's great to have you with us.
Thank you.
Good to see you. As you know, it's a big travel week for a lot of families. Do you think infections will surge when they come back home?
Well, I think there's going to be an increase because you have a lot of kids who are traveling and going to different places. But I suspect the increase will be a little bit less than over other travel and holiday heavy periods because basically there's not a huge difference between the type of exposure that kids are having locally and when they travel. So I think there's going to be a bit of an increase, but probably not like a surge.
Dr. Malley, many schools have discontinued pool testing. So won't that make it harder for parents to know if their child has been exposed?
Yes, it becomes much harder to know if there's an exposure to, for example, an asymptomatic child. But if there's a child who presents with symptoms, who is subsequently diagnosed with COVID, I think that the parents will be able to know from the school that will notify them.
We know too what's circulating right now is a subvariant of Omicron. If a child though is infected, what's usually the first sign? I mean, does it vary child to child?
Yes, it does. I mean, I think, the most common symptom is, as you know, no symptom at all, and the child is asymptomatic or very mildly symptomatic. Sometimes kids present with fevers, sore throat, cough. One of the interesting aspects of this particular variant is that it seems to be associated more often with a condition called croup, so much so that some pediatricians have ended up calling this particular variant Crovid for a combination of croup and COVID.
So COVID tests that you can use at home are available in many locations and they're often free. So is there a certain brand that works better for children? What's your advice?
Any brand really works. They're all nasal. You always have to swab the nose. And what I tell parents to do, particularly if it's not a stressful situation, if there isn't any concern about somebody's, being very sick or needing to go to the hospital, for example, in the family, that it's actually a very important educational experience for kids to see how these tests work.
Right.
What does a positive control mean? What is a lateral flow? And I think some kids really get a kick out of learning a little bit of science by making also sure that their family is healthy.
That's a great idea. I mean, a real life application of what they need to know. Dr. Malley, it's great to see you. Have a great weekend.
Thank you.
Sure.